Hello, how are you? I'm Dr. Prabir, your friendly Yoruba. Okay, I mean, having this series of video blogs on testicular pain, okay, scrotal pain, and in continuation, because this is the episode 2 of the series. It's a very important one. Don't neglect the series I'm talking about because scrotal pain or testicular pain is very common. Okay, in all age groups, very common. It's especially important in the mid 30s, who are the most reproductive, the most productive, not reproductive, most productive age group of our society. As also in early 20s, 40s, 50s, it can happen to any age group. Okay. Today, I will be talking about what is known as a chronic testicular pain, or in medical parlance, it's known as a chronic orchialgia. Now, by definition wise, it means that there is a pain in the testes, pain in the scrotum, which is either constant, okay, or it is intermittent, but it goes on for a period of 3 months by definition. Now, this is a very frustrating problem in the sense that the patient is gets frustrated because see, the pain is always not acute, but it's of a annoying type. It always disturbs the patient. Doesn't the patient is not able to carry on his normal activities? Okay. Second is the doctor, the physician himself gets frustrated because we physicians don't have a set protocol for the management and treatment of diseases, and because of the fact that chronic scrotal pain has varied causes, okay, and most of them are idiopathic, means most of them don't have really a issue. Okay, can't find an issue. So it always this is the cause that the patients go to one doctor, then they go to one doctor. And basically the patient doctor relationship goes a bit on the odd side. Okay, so that's very important to understand. That I will tell you what are the basics. Basics. Try to understand. My purpose of this video is that you will understand the basics of what is a chronic testicular pain, okay, which many of us suffer from. What can be the causes and what can be the treatable cause? That's very important. What can be treatable causes and when will you take medical help? The whole purpose of these video blogs is simple thing. This is the simple thing. Okay, so let me tell you is the all test this is chronic testicular pain I'm talking about, isn't it? But let me share my whiteboard. That will be more easier for you to make you understand. Okay, just hold a sec. Right. Okay. So if you're able to understand, I will draw some. This is the okay. This is the testis. Fine. Okay. This is the testis, and this is the anterior part of the testis. So this is the posterior part of the testis, and over here is what is known as the epididymis. I talked in the video one regarding what is epididymis. Okay. So it's basically a channel, a coiled tube which transports semen, which is produced and transports sperm more specifically, which is produced in the testis to the next structure, which is known as the vas. From here, it goes to what is known as the vas. Okay? This is suppose this is the vas. Now, and I tell you what, the sac which contains all these structures is known as the scrotum. This is the scrotum. It's scrotum, and this is testis. Okay, this is epididymis. Okay, and this is vas, and vas with a lot of nerves, lot of blood vessel arteries, that's testicular arteries, testicular veins, and they form what is known as the cord. It's known as the cord. I'm sorry because of my this thing handwriting on the whiteboard. It's known as the cord or the spermatic cord. So there can be many causes, not only testes. So the cause of the pain can be from the paratesticular organs also. It can be from the epididymis. It can be from the vas. It can be from the cord structure. And tell you what, because the nerves are in abundance in this area, that is the spermatic cord, so it's more likely that the pain is from the this thing. Okay, pain is from the uh, okay. Let me right. So pain is from the subchromatic cord. Now tell you what, try to understand. All testicular pain are not testicular pathologies. You can understand that. So testis can have tumor, Testis can have torsion when the testis moves around. I will talk in another video what is testicular torsion. Very important. It can be infection of the epididymis. I talked about epididymitis in the previous video. Okay. It can be some injury or some post-operative causes of the vas, like post-vasectomies, or it can be some cystic dilatation of the epididymis of the channel that carries the sperm, which is known as the spermatocyst. Okay, or it can be an epididymal cyst. So these all can be causes of pain of the testis. So better use the term scrotal content pain. Okay, scrotal content pain. So it encompasses a varied pathologies encompassing all within this scrotum, the sac, contains all the structures. Now, another very important thing I want to tell you is not all scrotal content pains originate in the scrotum. Okay, try to understand this. Pain can be elicited from testis, epididymis, whatever, but the cause of the pain is somewhere else. Okay, it's called a referred pain. Referred pain is basically referred by these nerves. So what can be the cause? The person can have an inguinal hernia. Okay, person can have inguinal hernia. Person can be operated for inguinal hernia. Post-operative case, especially when there's a nerve is cut or suppose a nerve gets entrapped in one. There are many nerves in when you do a surgery. Entrapped into the fibrosis, that is the tissue reaction occurs after surgery. Okay, that's very important. Very important cause is a stone in the mid or in the lower ureter. Okay, suppose say this is the kidney, this is the kidney, this is the ureter. A stone getting stuck over here, okay, can elicit a testicular pain. Very common. Many cases, patient present with a firstly they have pain in the abdomen. Okay, then the pain goes to the testis. They say, Doctor Saab, mere ko tabhi testicular pain hai. You do an ultrasound and you find there's a stone stuck in the ureter. Very important cause. They're called referred pains. Another very important cause of referred pain is postural. I'll tell you what, this is very important, very important. Okay. Now, what is known as if I sit like this is a chair. This is a stiff chair, isn't it? I can put a hand behind my back. It can easily move, right? Behind my lower back. So when a person sits like this is known as the lumbar lordosis. Okay. The spine is a bit hunched on the front side. Okay, so you can always put a hand behind. Now the very important thing, you have to sit very stout. Okay, your head is in the front, your shoulders are dropped back and retracted. This is a normal position of the human being when he sits. Now suppose you are on a long drive. You normally take long drives, and most of us don't have ergonomically engineered driver seats. Okay, or we are sitting on a computer for a long period of time and hunched back. That's very common, huh? Very common to all the people. So because of the postural problem, or you are riding a bicycle for quite some time, especially the racer bicycles or racer bikes. Okay, so because if the loss of normal lumbar lordosis, you can have muscle spasm and referred pain in your scrotum. That's very important. Okay. So what did I tell you? I told you about the scrotal pain, which is originating from the scrotum, which can be referred. Okay, that's very important. You have to understand what are the causes. Third is point very important. Especially now, these are all known as nociceptive pain. Nociceptive pain is suppose you are pain in the testis, you just compress the testicular tissue a bit and you have a lot of pain. That means there's an anatomical cause for pain. Anatomical cause of pain. Okay. Same thing, now there can be a referred pain also. Based on the abdomen, it's a pain, but this is also referred pain in his scrotum. Now, friends, this is very important to understand. What happens is all pain is carried by the nerves. This is a nerve sensation. Suppose this is the scrotum, okay, and the pain fibers goes to the spinal cord, and again as pain sensation goes to the brain. Okay. So suppose there's repetitive attacks of this pain, repetitive attacks. What will the brain do? What will the spinal cord do? They will become sensitized to this repetitive painful stimuli over a time period, so that now even if the obnoxious stimulus is removed, even a stimulus which is not worth mentioning can elicit pain by what is known as the hard wearing of the central or the peripheral nervous system, whatever is nervous system. So I can understand that it is because of some problem in the adaptation of the neurologic system of the human brain or spinal cord, that the person can have pain in his scrotum, but again, there is no stimulus present for the pain in the scrotum himself or anywhere else. This is known as the neuropathic pain, very common in diabetic individuals. They will have a burning sensation. It's not a pain, okay? Nociceptive pain is pain. Is of discomfort is pain. Okay, you can say it's pain. This is a burning sensation, okay? It goes to the scrotal skin. He says there's some burning sensation happening in my testis, and the burning sensation is going to the scrotal skin, and it's got moving somewhere, and I'm totally confused. This is known as neuropathic pain. I will tell you another cause of this neuropathic-like pain that is present very common in diabetic individuals. Patients will complain of pain in the flat of the foot, on the undersurface. Patient will complain of pain in his scrotum. This is all very common neuropathic pains. Okay. The other thing is, these are very difficult to treat, very difficult to evaluate, very difficult to treat. Okay? You need expert treatment and prolonged treatment. Okay. Another cause of pain is very common is CPPS, a condition known as the chronic pelvic pain syndrome or a chronic prostatitis. Typically happens in very type A individual males, very harried, okay, always on the move, always busy, always in deep anxiety, okay, and constipated, right? These have chronic prostatitis, okay, chronic inflammation of the prostate. I will come to this. I think I have a video in the YouTube. You can also check it out, right? And I will talk also about chronic prostatitis. What happens is, try to understand. Say, okay, say this. Let me use this space. A shorter space. So suppose this is the urethra. This is the prostate. Okay, and this is the testis or the scrotum. Scrotum. This is the testis. So from here, there is a vas which goes over here, and the ejaculate comes from here. So this is the ejaculatory system. A sperm comes from here, goes into the urethra, goes out in ejaculation. Now, what can happen in this chronic prostatitis? There is reflux of infected material or infected urine from the prostate. Okay, backflow or retrograde reflux into these structures, right? Your testis. So, a chronic prostatitis can cause chronic scrotal pain. These are the facts. These are the causes that we know. Okay, so if you can understand, these are the typical causes of treatable pain, treatable scrotal. Because most of these are because we can't understand what is the cause of pain. But if you try to understand, this can be the treatable cause of pain. Then we can take expert medical help at the opportune moment. So my desire is that you don't suffer, because most of us suffer from this problem. It's a long time after we are suffering from this problem that we really understand this is a big issue, big problem that we are suffering from. Okay, it's a paradox. So that is very important. Okay, so fine. This is what I wanted to tell you in short. So I will come back with another such important video. So if you like the video, please comment. If you have any question, please comment. And if you are in my Facebook, if I just see you're seeing in the Facebook group, we're always there with you. You're always commenting. If you're feeling this in the YouTube channel, do please comment and subscribe to my channel. And please, this is my request. Please come to my Facebook group, and it's we are posting a lot of important videos. So as usual, stay fit and be healthy, and we will see you later. Bye bye.